Hi, I would like to talk about the initial assessment in the first time. The first thing that we need to examine will be the husband's sperm count in terms of quality, quantity of the sperm. The sperm sample has to be produced 3 to 5 days after abstinence, after which it will be analysed in the lab. During the analysis, there are a few things which we will assess. Firstly, the concentration, which is the number of sperms which are there. How many million per ml? It should be more than 15 million per ml. Anything less than that is known as oligozoospermia. The second thing would be the motility. Motility means movements. We must have at least more than 30 to 40% motile sperms in the sample. Thirdly, known as morphology, which is the shape of the sperms. The normal value is more than 4%. These are taken as normal quality sperms. However, anything less than 4% then is known as a teratozoospermia. There are many reasons as to why the sperm quality can be reduced. Firstly, lifestyle, smoking, unhealthy diet, increase in weight, infection, heat. All this will make the body unhealthy. And when the body is unhealthy, the sperm quality too will be affected. The most important advice that I give my patients, number one, lose weight. Stop smoking and also stop vaping. A lot of patients who smoke feel that vaping is a safer option. No, they all have the similar type of effect. Be it smoking or vaping, you're taking in all chemicals into your body which makes your body unhealthy. The other thing would be change your diet, healthy food, lose weight, exercise, reduce the sugar in your diet. And next, be multivitamins. Vitamins which are antioxidants, for example, vitamin A, C, E, zinc, selenium, CoQ10. These will make your body more healthy. When your body is healthy, your sperms will be healthy too. The second assessment is for the woman. It's called the ultrasound scan, where we'll do a transvaginal ultrasound scan. And this method will assess the inner lining of the womb, called the endometrium cavity. Secondly, we'll assess the womb wall, which is known as the myometrium, and the ovaries, both sides, left and right. We'll try to rule out presence of any abnormalities, for example, polyps, fibroids, cysts. Basically, if you have these problems, then you may have to undergo some form of surgery to remove it. And nowadays, surgery is by minimal access, also known as laparoscopic surgery. Gone are those days which you will need a big scar on your tummy to remove a fibroid or cyst. Nowadays, everything is done by the keyhole method. Okay? Hence, the bleeding is lesser, your time off from work is lesser pain and faster recovery. The other method is a hysteroscopy. A hysteroscopy is a method where we'll insert a fine camera into the womb to assess the inner lining of the womb. If you have a polyp or you have anything irregular in there, we'll remove it for you, because if the womb is nice and smooth, it increases your probability of getting a pregnancy. The third thing to be done is the blood test for the female partner. The blood test will stain your hormonal profile. Now, especially in those women who have irregular menstrual cycles, then the blood test has to be done on the second, third, or fourth day of the menstrual cycle. This to check the follicular stimulating hormone, luteinizing hormone, the estrogen level, or the fasting serum insulin level, and your blood sugars. And the other blood test you can do is to assess the other organs in your body, for example the thyroid, where thyroid hormones, the prolactin, these hormones interfere with your ovulation, your menstrual cycle. Hence, mandatory for us to assess them and to make sure it's normal. And if it's abnormal, you have to get that treated before going in for a fertility treatment. The other blood test which is important is your test for ovarian reserve, called the anti-Mullerian hormone. By doing this test, you'll know how many eggs that you have and where you stand, whether you have good ovarian reserve or low ovarian reserve. That will determine how fast you need to act in order for you to conceive. And finally, the test for fallopian tubes. The fallopian tubes is very important because it's a bridge which connects your eggs and the sperms. If it's blocked, then there's no way you can conceive naturally. So it's checked by, number one, by HSG, hysterosalpingogram. This is performed by a radiologist who will insert a small cannula into the womb and inject the dye. He will take a few pictures or radiographs to assess the flow of the fluid inside the fallopian tube. Secondly, we can do laparoscopic surgery. So laparoscopic surgery can be performed for various reasons. So if you have to do one, then you can assess your fallopian tube by injecting the dye into your womb and recording the flow out from the fallopian tubes. Thirdly, another process called saline sonohysterogram, where the doctor can inject fluid into the womb and at the same time do an ultrasound to check the patency of the tube. Once the tubes are open, then there's not a problem. You can try to achieve pregnancy in a natural way. However, if it's blocked, then you're probably looking at IVF, test tube babies. Next is the supplements. There are a few supplements which you need to take. Number one is folic acid. Folic acid will reduce the risk of your baby to get brain, skull, spine problem called neurotube defects by more than 70%. Secondly, vitamin D also improves your chances of achieving a healthy pregnancy. There are other medications which are usually given to certain women, especially those with a high insulin resistance, which is known as metformin. This medication is usually given to diabetics, but it also helps in the body using up the sugars more efficiently. Subsequently, depending on the outcome of all these assessments, your doctor will decide whether or not to give you some tablets to grow your eggs called clomiphene citrate or letrozole, or should we give you injections instead to grow the eggs. Or if your partner's sperms of below average level, then you may have to do an intrauterine insemination, or if the tubes are blocked or the sperm sample is poor, then you'll have no choice but to do in vitro fertilization, also known as test tube baby. If you would like to know more about this, kindly leave your comment below and I'm happy to answer your questions. Thank you.